Dr. Stephen Thomas to News Channel 9. We appreciate you being here. He's an infectious disease specialist, real expert from Upstate University Hospital, guiding us through this. We want to talk about the coronavirus. First, the news today is New York State now has more cases than any other state in the country. So let's talk about that and what that will mean for Central New York.
Sure. So globally, we see an increase in confirmed cases of about 3,000 to 4,000 new cases every day. There are about 607 cases in the United States right now, with hotspots in Washington and California and New York. As you mentioned, New York has about 142 cases as of about 11 a.m. this morning, which makes up about 23% of all the cases in the United States. As mentioned, Westchester and Nassau counties have the highest number of cases, and along with New York City. No
confirmed cases in Central New York. We want to just confirm that for everybody, but can we expect that it's going to make its way here?
Well, as was mentioned, you have 2 cases now in Saratoga County and 1 in Ulster County, and so it's clearly making its way north. It would just stand to reason that ultimately it's going to make its way to Central New York.
All right, which leads to my next question. How prepared are we as far as testing? Do we have enough preparation underway to test for the coronavirus here in Central New York?
Yeah, so testing is a big topic that people want to talk about. So in addition to the state lab at Wadsworth, there are some commercial labs that have come on board just today with testing, so both LabCorp and Quest. Upstate is slated to adopt the test from the state lab at Wadsworth. That's going to be a couple of week-long process, but we're working closely with the state to bring that capability to Central New York.
And what exactly will that mean for us here?
Well, I think hopefully it's going to mean that there's going to be shorter turnaround times in terms of physicians requesting tests, and then those tests being able to be completed, and then that information getting back to the physician so they can make treatment decisions and isolation decisions for their patients.
All right, and let's talk about just for the average person. It's hard to tell right now because the symptoms are so close to the common cold. Yeah. So if you come down with the symptoms, do you go to the emergency room? You want people to stay out of the emergency room, right?
Yeah, no, that's a very good point. So as I've been saying, preparing for an outbreak and responding to an outbreak is really a team sport. It's really a team event. And so everyone can do their part, and that includes the Central New York citizen and resident. So the first thing that they can do, and I won't go into the details because I've done it before, but hand hygiene, respiratory hygiene, and if you're sick, you should stay at home and not go to school or not go to work. If you are sick, do not immediately run to your primary care provider or the emergency department. You should call them. There is a very big educational campaign going on right now with the primary care network in Central New York, and those people are aware of what to do. So make a phone call first, have a discussion. Your primary care provider will give you guidance.
Yeah, because you don't want to stress the emergency rooms at this point.
Yeah. No, that's absolutely correct. So if COVID-19 does come to Central New York, there is definitely a certain population that is more at risk than another population, and we want to make sure that that population can access the emergency departments, can access the wards at the hospitals, and that the people who are less ill and can be taken care of at home, that's where they are.
So important to stress that. And there's so much misinformation out there right now. It seems like it's spreading just as fast as the virus is.
Yes, unfortunately. So, pay attention to your local departments of health, pay attention to the Centers for Disease Control and Prevention, and I like to think that you can pay attention to your local healthcare providers.
And we'll keep paying attention to you. We so appreciate you being here and helping us through this. You've been a great voice on this for us. Thank you,
It's my pleasure.
Dr. Stephen Thompson.